Hi, I'm Matt Roy from Blue Ocean Benefits and Consulting, www.blueoceannj.com. Today we're going to talk about Maximum Out-of-Pocket, MOOP for short, M-O-O-P, Maximum Out-of-Pocket. Some states require a maximum out-of-pocket, some don't. It's actually a scary number. People are frightened by the maximum out-of-pocket, but it's actually a good thing for you as the contract holder. Maximum out-of-pocket is simply exactly what it sounds like. It's the maximum that should come out of your pocket. It's not the maximum a carrier will pay. It's not a maximum that the carrier will cover. It's the maximum that you should come out of pocket. A couple things you have to watch out for depending on the state you live in and where the group is citist, which means what state the group is written out of. Sometimes summaries will show the maximum out-of-pocket, including the deductible if there is one. Sometimes it won't. Sometimes maximum out-of-pockets will include prescription copays. Sometimes they don't. So make sure you look at your own individual plan and ask those questions. Does the maximum out-of-pocket include all copays? Does it include the deductible? Is this number I'm looking at all inclusive of everything? Depending on the plan, you will see that sometimes what's real common, for example, a maximum out-of-pocket will include all your copays, all your deductibles, all your coinsurance, but not prescription copays. And that's because very often a prescription plan is written as a separate, technically written as a separate piece of business. So it's important to make sure you ask those questions about what is included in your maximum out-of-pocket. So a common maximum out-of-pocket is $5,000, okay, for a single. And how that might work on this plan, might have a $2,500 deductible, might have some coinsurance or some copays, but altogether you can't spend more than $5,000. Okay, so whether the bill is $6,000, if it's $6,000, you might not get there. Whether the bill's $10,000 or $50,000 or $500,000, your maximum out of pocket on this plan, $5,000. Okay, if you're a family, you will often see a max, or family, or a parent-child, parent with children, or a husband-wife. Meaning anything other than a single contract, you'll very often see a maximum out of pocket of double that. So in this example, 5,000 turns into 10,000. Couple different ways that can be handled. This gets a little confusing. Again, you have to ask questions of your own advisor and your own plan. But there's two ways that will work. And if you watch our deductible video, we talked about these kind of things 2 times in aggregate. Some maximum out of pockets are in aggregate, meaning any way that the family meets the 10 grand covers them. Some are, each person has their own 5,000 and the family has a 10,000. Really depends on what your plan is. The bottom line though is that every plan has a maximum out of pocket, or not every plan, but most plans have a maximum out of pocket. If your plan doesn't have a maximum out of pocket, you might have some unlimited exposures to consider. If you're choosing between 2 plans and one has maximum out of pocket that doesn't include certain copays and the other one does, that's really something you want to look at. Ultimately, when you're insuring yourself, your health insurance, the little claims you can figure out a way to pay. It's the big claims that you can't. A $50 or $100,000 claim is the one that's tough to pay. Having a maximum out of pocket will keep you from having a claim like that. So if it's a $5,000 claim or a $2,500 claim, maybe you can find a way to pay the providers, pay the hospital over time. But if you had a $50,000 claim, you wouldn't. So a maximum out of pocket is extremely important. Again, very important to check with your plan design and your advisor to make sure that that number includes everything we just discussed. I'm Matt Roy from Blue Ocean Benefits and Consulting, www.blueoceannj.com.